So, what is a doctor's real job? Today, we're going to dive into a really powerful text from the early 19th century that answers this with just, wow, stunning clarity. Yeah, it's a historical perspective, but you know what? Its message about what a professional's core mission should be, it feels more urgent now than maybe ever before.
And boom, right out of the gate, the text just lays it all out. No ambiguity at all. A physician has one high and only mission: to restore the sick to health, to cure. Simple as that. This isn't just, a suggestion. It's presented as the absolute, fundamental reason the entire profession even exists.
And the author really hammers this home. This isn't just one goal among many. It is the only one that truly matters. A singular, unwavering focus, period.
And there's a real power in that simplicity, right? It's so direct. There's just no room to misinterpret it. This is held up as the ideal, the true north for any healer. But as we're about to see, even the best ideals can get lost in the noise.
Okay, so this brings us to the core conflict. The text points out this really dangerous trap that physicians can fall into, a path that pulls them away from their duty. It's the trap of theory. That moment when the act of knowing something starts to feel more important than the act of doing something.
And here's the crucial point. This pure, simple mission, it often gets forgotten. The author argues that physicians get distracted. They start wasting their talents and their precious time on things that might sound really impressive, but in the end, do absolutely nothing to help the person who is actually sick.
The text draws a really clear line in the sand here. On one side, you've got the true mission: to act, to help, to cure. And on the other side, the distraction: to theorize, to speculate, to explain. These two paths are presented as being completely at odds with each other.
And the author gets super specific about what these distractions look like. He's warning against building these elaborate, so-called systems based on nothing but empty speculation, or getting lost in abstract theories, or trying to explain things that honestly might be unexplainable. It's a really sharp critique of what you could call intellectual vanity.
The author actually gives this whole distracting way of thinking a very specific and, I gotta say, very critical name. It's a label for a type of medicine that has totally lost its way.
He calls it theoretic medicine. And let me tell you, that is not a compliment. For this author, that term represents a total betrayal of the real work, a detour into what he calls learned reveries that offers zero practical value to the person who is actually suffering.
But the critique goes even deeper than just, wasting time. The author argues that this theoretic medicine is also a kind of performance, a sickness of words that's designed more for the physician's ego than for the patient's well-being.
See, the argument is that this isn't some genuine search for truth. Nope. It's a performance, a show, and it's a show put on for a very specific reason, a reason that has absolutely nothing to do with healing anyone. This quote just captures the point perfectly. The motivation, he says, is to wrap up ideas in all this complicated, unintelligible language. And why? So it will sound very learned in order to astonish the ignorant. It's about creating an illusion of wisdom, not actually providing help. So you have to ask, right, what are the consequences? While all this intellectual posturing and complicated talk is going on, something absolutely vital is being ignored. There is a real human cost to this performance. And there it is, the emotional core of the whole argument. While the theorists are busy talking, sick humanity sighs in vain for aid. It is just a devastatingly simple and powerful image of real suffering and real neglect.
Okay, so after that absolutely scathing critique, where do we go from here? Well, the author doesn't just diagnose the problem, he offers a solution. It's this passionate, urgent call to action, a call to get back to the true mission.
The message is basically, enough is enough. We've had quite enough of these learned reveries. The time for talk is over. It is high time that everyone who calls themselves a physician finally gets back to their one true job. And the plan is laid out in two beautifully clear steps. Step 1, cease deceiving suffering mankind with mere talk. Just stop the performance. And step 2, begin to act, to really, truly help and to cure. It's a command to shift from theory back to practice, from words back to action. When you boil it all down, it's this incredibly powerful reminder that just feels timeless. For any true professional, in any field, the goal isn't just to understand a problem, it's to solve it. It's about making a real, tangible, positive difference.
And that leaves us with a really provocative question, one that goes way beyond medicine, right? In our own work, whatever it is we do, how do we strike that critical balance between knowing and doing? When does trying to learn more become an excuse for not taking action? And how do we make sure we never, ever lose sight of our own true mission?